the scale of the epidemic, the sheer number of cases, the rate of spread, all of that is unprecedented. The narrative that's been painted, it's one of despair. But despair doesn't end epidemics, only problem solvers with solutions do. And I think a lot's been done. Early on, there's a tremendous amount of fear. There's still some fear. There's also a tremendous amount of resolve. We know how to control this. We find the sick early, get them to care, and we make sure those that are exposed get supported, and if they fall sick, we get them to care and prevent it from going further. So what do you need to do that? It's really a full court press at every level of the health system to try to both stop this disease, and I should add, build something better for the future. We now need to surge our community health workers in a very rapid way. If you could do that, we could drive the mortality lower. Maybe it could be less than 25%, less than 20%, less than 10%. Most people die from this disease in remote villages that are days from the nearest formal healthcare system, and we don't have health workers in these places. So this is a symptom of a system that's failed, and it exposes a reality that rural, remote people around the world face, that illness is universal and access to care is not. And so that's got to change if we're going to fight this outbreak. If we only have an emergency response without strengthening a long-term system, we are going to be just as vulnerable as we were before this. We have to reimagine what this end game looks like here. It doesn't just involve controlling the disease. It involves getting a health worker in every remote village. That's the metric, the yardstick by which we ought to measure ourselves. As Paul Farmer has said, the root of ill in the world is the idea that some lives matter less. And there's no more poignant sign that some people can get health care. The same human beings can get health care by virtue of their passport or by where they grew up. When I was 9 years old, I was evacuated for different reasons. And we left hundreds of people on the tarmac when the cargo plane that took us away left. And so I know it firsthand that it erodes dignity. That's got to change. We need health care for everyone, no matter where they live, no matter who they are. So this is absolutely, fundamentally an issue of inequality.